Prostate cancer is the most common non-skin cancer among men, among American men. There are about 190,000 cases of prostate cancer each year. Some risk factors for having prostate cancer would be if you have a first-degree relative that's had prostate cancer, if you're from Scandinavian descent or from African American descent. Taking testosterone replacement has not been shown to cause a man to get prostate cancer. Most men have no symptoms from their prostate cancer unless they have an advanced case of prostate cancer. So a lot of times we'll have patients come to our office with urinary symptoms. And one of the concerns that they have is that, are these symptoms being caused by prostate cancer? Most of the time the answer to that is no. Those symptoms are often due to an enlarged prostate. However, there are sometimes in our evaluation of men that have an enlarged prostate, we may come across some risk factors for prostate cancer, such as a high reading of a PSA. PSA stands for prostate-specific antigen. This is a protein that's present in the prostate gland. Every man has a different PSA level, regardless of if they have prostate cancer or not. However, it is important for men to know that, number one, you can have prostate cancer, but also have a normal PSA level. And you can also have a high PSA level, but not have prostate cancer. So we use PSA as a guide to help us determine a man's risk for prostate cancer, but it's not possible to lower your PSA. There are medications that we have that can lower your PSA, but those are not used in all situations. Now, sometimes we can actually feel prostate cancer when we do a digital rectal exam, but most of the time we do not. The treatment options for prostate cancer are going to be based on the grade and the stage of the cancer. Grade of prostate cancer is going to be broken down into low grade, intermediate grade, or high grade. Stage of the cancer has to do with if it's localized, so for instance localized to the prostate gland, or if it has spread outside the boundaries of the prostate. Has it gone to the lymph nodes around the prostate, or has it gone to a different part of the body, let's say the bones? Stage goes from anywhere from stage 1 to stage 4, and your doctor will talk to you about that once diagnosed. For low-risk prostate cancer, many men are going to be put on a surveillance program where we're watching the cancer very closely for any changes. If we feel like a man actually needs to have treatment for prostate cancer, those treatments are going to fall into really two broad categories. One would be surgery. At the Urology Center, we perform almost exclusively robotic prostatectomy for prostate cancer. There's also radiation treatments for prostate cancer, which would involve externally directed radiation or sometimes internal radiation seeds. Less common treatments for prostate cancer involve using high-frequency ultrasound to kill prostate cancer cells and also freezing prostate tissue. Treatment options for advanced or metastatic prostate cancer are going to be quite a bit different than the treatment options for low-grade or low-risk prostate cancer or even intermediate-grade prostate cancer. What I mean by that is patients who have prostate cancer that has already spread to a different part of the body are going to be directed towards medical therapies to treat the prostate cancer. And in those cases, even though we might not be able to cure the cancer, we have access to treatments now that should be able to prolong life by several years, as opposed to, let's say, the options that we had even 5 to 10 years ago. The most common side effects for men who are undergoing treatment for prostate cancer usually fall into 3 different realms. One would be erectile dysfunction that occurs in up to 50% of men who have treatments for prostate cancer, such as surgery, radiation therapy. The second would be problems with urinary control. Those symptoms occur in about 10 to 15% of patients and are usually treatable. The third would be rectal complications. Those are usually related to radiation treatments. Fortunately, the rates of long-term complications related to that are in the range of 5%. But rest assured, there are a number of different treatment options that we have to deal with some of the side effects that can come from getting prostate cancer treated. At the Urology Center, we are well positioned in the community to provide the highest level of care for patients who have early stage prostate cancer and advanced prostate cancer. We work very closely with medical oncology, radiation oncology in a collaborative fashion to make sure we come up with a treatment plan that is sound and is individualized. If you have concerns about your risk of prostate cancer, your prostate health, if you've had a family history of prostate cancer, if you have urinary symptoms that are bothersome to you, please give us a call at the Urology Center or visit our website. We'd be happy to set you up to see one of our board-certified urologists to talk about your concerns.